I'm Dr. Will Hendren, CEO of Qura, and delighted to be here. Qura is a digital health company that's taking a revolutionary approach to managing two of the most important chronic diseases we face, hypertension and congestive heart failure, through implanted pressure sensors, software, and data. Our breakthrough technology enables continuous collection of patient pressure data that is seamlessly relayed to both patient and the physician. This in turn enables real-time remote patient management. Effective management and care of patients with these, in fact, most chronic diseases are limited by two big problems. One, methods to measure high quality and continuous out of office or out of hospital data and to communicate that data seamlessly simply don't exist today. And two, patient engagement and compliance are challenging and generally poor. Qura solves both problems. Qura is a data story, and AI plays a major role. Real-time programmable alerts will identify pressure changes that need to be acted upon immediately, and AI will generate predictive analytics that can anticipate adverse events and improve patient outcomes. This is an overview of our system. If you look at the lower left-hand corner, you'll see the implants are placed in the arm for hypertension or in the heart for congestive heart failure. The data is continuously and seamlessly transmitted to the cloud where the analytics reside, and then the data, alerts, and analytics can be delivered to virtually any output device. So quite literally, with the patient's data in hand, the patient can take specific therapeutic action based on established algorithms or based on direct physician input. And this 24/7 seamless access promotes patient engagement and eliminates the problem of patient compliance. So our system is enabled by a host of true breakthroughs in implantable technology. These are focused around size, powering, packaging, telemetry, and the quality of our data. All told, our final device size is the size of a grain of rice. And all of the technology has been validated both in vitro and in vivo. The markets that we are engaging are truly massive, both literally multi-billion markets for both hypertension and failure. And just with a very conservative penetration of market, we will generate enormous revenue as well. Our business model is robust with multiple revenue streams. These are low-cost, high-margin implants, and so we will have revenue from device sales, and then we will have monthly recurrent reimbursement for data collection, monitoring, analytics for the life of the patient, thus really an annuity stream. And very importantly, the device reimbursement and monthly monitoring CPT codes already exist, which removes an important business risk. We are an extremely experienced team. We have world-class engineering, clinical, and commercialization expertise. We are seeking and raising $15 million in a Series A extension, which includes up to $3.5 million in convertible notes that will convert at a significant discount. And these funds the proceeds will fund to first in man for hypertension and potentially congestive heart failure as well in the next 18 to 24 months. And we value venture assistance. So to conclude, there are multiple reasons to invest in Qura. We are taking a revolutionary approach to disease management enabled by technology that's disruptive. These are massive markets, low-cost, high-margin devices with multiple revenue streams. We have experience. It's $15 million to device completion, validation, and the doorstep to multi-billion-dollar markets. And in addition, in the future, we have multiple planned applications and clinical targets, and this is truly scalable on a global basis. Thank you.
Fantastic. Thank you, Will. Just take a couple questions here. Is the device that you're developing a single device used for both hypertension and congestive heart failure, or are there different devices for the two applications?
Thanks. That's a great question. So to be clear, let me clarify. We're actually developing one device. Yes, they are different diseases, but these devices will be placed in different locations, obviously. And so basically, it's one device, but different configurations. It will have the same overall form factor, powering, size, et cetera, et cetera.
Great. That leads to another question. You've stated that you have multiple additional clinical targets for the future. Can you give us an idea of those?
Yeah, that's right. So we actually view this as a true platform technology. And the concept is that we can get data out and we can keep this device continuously powered. And because of its tiny, tiny size, there are really multiple places that we can put this. So there are lots of different diseases that are so-called pressure related. It's all about the pressure. So pulmonary, in the cardiovascular space, there are many, such as primary pulmonary hypertension, putting this as an adjunct to existing devices, like putting them on heart valves, et cetera, et cetera. But there are also diseases in the brain, hydrocephalus, in the eye, glaucoma, in the bladder, et cetera, where we know that we will find utilization. And we're actually also working on a very early stage on an application, not around pressure, but for measuring blood sugar as a permanent implantable sensor for diabetes and blood sugar control.
Wow, that's significant. Thanks for sharing that. It really feels like injectable and implantable devices have kind of been waiting in the wings for a few years, and the full potential and acceptance hasn't been realized. What do you think needs to happen for these types of technologies to take hold? And has COVID changed any of the market acceptance?
Well, that's a great question. And I'll tell you my view is that in 5 or 10 years, it will be commonplace for patients with chronic diseases, especially where this is tailor-made, could have 2 or 3 or 4 different, sensors in them. I truly believe that we figured out some things that nobody else has. And I've told many people that I believe this innovation could usher in exactly what you just asked, the era of implantable sensors. And the reality of it is, COVID has changed things and forced some of this thinking, but we've been working on this for 5 years. And so, we anticipated exactly what you said, and we feel that we're in a good position to really make this revolution start.
Yeah, the overnight success in healthcare is like 11 or 12 years.
Yeah, that's right. Couldn't agree more.
Yes.